Hi guys, hey, it's Dr. Marquez here from Back Pain Relief Center, and we have Joann here with us today, and she's a very unique case. She has had some very bad neck problems for a long time. She's actually had a fusion, was it C4, C5, C6, or right around there. So basically all these bones in their lower part of her neck are fused together. So you get a lot of patients that go to the orthopedist and to different doctors, and they have these operations done, and they still have pain after. So she still had a bunch of pain after it was done. Now look, when you get to the point where you need surgery and they have to go in there to fuse it together, there's a reason why they want to do it. And they do a great job at doing what they're supposed to do. What they don't go over with you, or at least what they didn't go over with Joann, is that when you do this operation, you decrease the function of your neck. And anytime you decrease the function, sooner or later it's going to start some problems down the road, which, about how long was it after your surgery you started feeling pain?
Less than a year.
So less than a year, all of our pain started coming back. And what happens is that the neck doesn't move quite right, doesn't rotate, doesn't bend, and all of these muscles get really tight. And they start dysfunctioning, and it snowballs into this repetitive stress-like disorder that can cause all kind of problems. She got to the point where she didn't think anything was working. We got her in here, and we did a little bit, and we're getting her to feel a little better. Now, am I fixing it? Probably not fixing it. But are we helping her manage it? I think we're helping her a little bit. Now, a lot of patients come in like, well, I had a fusion. I don't want anywhere to go near my neck. Well, we're not going to do too many things to the neck because it's fused together. So as a chiropractor, we can't manipulate a joint that's not a joint anymore. It's fused together. So there's really not much to worry about as long as we're nice and careful. What we are going to do is loosen up all of these muscles, loosen it up so she has a little bit better range of motion. If she can function just a little better, she will feel better. So it is all about function, and it's all about managing her pain levels and decreasing her pain levels. Unfortunately, when someone has this surgery, it kind of pushes her head forward and alters the mechanics of their entire body, and it starts to make her low back dysfunction. So now she has some low back pain. So today we're going to do a little bit of muscle work on her. We're going to try to increase the function of her neck to get her pain levels to decrease just a little bit. So first thing we'll start with, I just want to see your range of motion. Can you look back for me? Okay, so not a whole lot of motion there. Come all the way forward. Come back up. Painful, huh? Hurts a little bit. Can you go to the side at all for me? And to the other side. So you can see, not much range in there at all. And I'm not looking to get a whole lot more, but if we can get 10%, 15% more range of motion, she'll feel just a little better. So the first thing we're going to start with is try to loosen up these muscles here. And if you were able to touch these muscles, they're just rock hard. It feels like she just got done lifting weights. You get done lifting weights? No. And that's what it feels like. So we're going to try to loosen that up a little bit for her. All right, so first we're going to do some soft tissue work on her to try to loosen her muscles up to hopefully increase some range of motion with this neck. Okay, so look up and down for me 5 times. 1, 2, 3, 4. Okay, you want to turn your head to the left and go up and down 5 times. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4. What I'm doing is putting some pressure on this muscle here to shorten the muscle belly, and we get her to go through a range of motion, and it just loosens that muscle up. It breaks some of that knot up. It gives it some more motion. And she'll tell you it's a little tender, but nothing that she can't handle. Here, we'll do it 5 times. 1, and we'll go straight ahead. 2, 3, 4, 5. Okay, to the front. 1, 2, 3, 4, 5. How you doing? Stomach back. 1, 2, 3.
You want to come watch
4.
the video?
No, it's okay.
Oh, okay.
She's all right. Here to your back pocket. You want to look at the camera and say hi? 1, 2, 3, 4, So a lot of people might ask, so why are we worried about this muscle so much when her neck hurts? Well, we want to loosen this entire area in order to give that more range of motion.
Why your phone on here?
Because we're taping it.
Not mommy's phone.
Here. 1, 2, 3, 4, 5. Okay, in the front. Walk on there. Straight up. 1, all the way up. So that's a little harder. 2, 3, 4, 5. Okay, stomach back. 1, 2, 3, 4, 5. Your back pocket. 1, 2, 3, 4, 5. Good. Okay, we'll take those glasses. I'm going to go face down. All right, so next we're going to move on to a manipulation. We're going to try to loosen this whole area, once again, to increase function and to hopefully make her feel just a little better. First thing we're going to use is an adjusting instrument. We're going to vibrate each joint, try to break up some scar tissue, increase the mobility of the joint, taking pressure off the nerves and the disc. By using these instruments, it makes the manipulation go much easier. All right, so we had a little bit of technical difficulty there, so we're going to go through what we just did to Joann. Once again, she has some lumbar spine dysfunction, so I had checked both of her legs. This one wasn't working correctly. And I'm just going to demonstrate the manipulation we did. We just did this and it got cut off on video, so I don't want to readjust her, but I checked her leg, so I had to raise this leg, so raise it up, and then we raised this other one, and this one wasn't going as high. When I see that, I know that her pelvis is off. So I had her lay on her side. So inside. And we did a spinal manipulation. I just put a little bit of pressure on there. Okay, we realigned that, fixed that up. We did both sides. So now we're going to have her go on her back for me, and I'm going to check her upper cervical spine. We know that her lower cervicals are fused together, but we still want to make sure that the ones below it and the ones above it are working correctly. This way they don't begin to degenerate. Okay, so look to the right for me, and then look to the left. Okay, and back to the center. So we have a misalignment of her atlas, and we're just going to adjust this. Now, very, very, very careful with this adjustment, and if you were going anywhere else, I would say don't even go have anyone go near your neck, but I know her body very, very well. We can't adjust the bones we're infused, so there's no problem adjusting an area. I'm going to be much higher. Nice and light. That's all it is. And she can probably feel some immediate relief from that. We'll check her legs again to make sure that it neurologically worked, and it did. Come up for me. We have one more manipulation. I'm going to have her sit on the edge of the table, and we're going to release her upper thoracics, because these upper thoracics will have a lot to do with the neck. If these are locked up, her neck's not going to work correctly. Good. A lot of popping in there, a lot of motion, real good release. Okay, stuff nice and straight for me. We're going to check that range of motion again. Can you look all the way back for me? Come all the way forward. Come back up to the side, the other side. It's amazing how much more range of motion we get from that.